Hi everyone, I'm Dr. Akhila, consultant fertility specialist, Sudha Hospitals, Hyderabad. Today we are going to talk about the best treatment for PCO. So let's first understand that polycystic ovarian syndrome, uh, there is no cure for this. So it is based on the symptoms that we cater to the patient in the form of treatment. So whatever symptoms are bothering the patients, that's what we are going to treat. And also what we need to understand is if the cycles are regular in a woman, even though she has an ultrasound feature of polycystic ovaries, androgen levels are normal, then we need not really worry about anything. So, one of the most important things in the treatment of PCO is lifestyle modification. So, this includes exercise and change in diet. So, in the form of exercise, we are looking at moderate exercise, and this includes about 3,000 to 5,000 steps per day. So the diet and exercise need to go in combination so as to maintain our BMI within the normal limits. So the normal BMI is between 18.5 to about 24.9. This is the normal BMI, and we aim to have the weight under control. So once the weight is under control, it brings about periods that could be regular. It improves the insulin sensitivity. It also decreases the androgen levels and decreases acne, reduces depression. So these are some of the ways in which lifestyle can bring about a positive change in the treatment of PCO. When it comes to diet, we are looking at a low carbohydrate ketogenic diet, which includes more of proteins and fruits, vegetables, nuts, seeds, avoiding processed food, avoiding fried food, avoiding reduction in alcohol or reduction in the caffeine intake, of course, reduction in trans fats and carbohydrates. This is the diet change that we are looking at once we are thinking of treatment of polycystic ovarian syndrome. Not only diet and exercise, in lifestyle, we're also looking at adequate sleep. About 6 to 8 hours of good sleep also brings about a very positive impact on the health condition in patients with polycystic ovarian syndrome. Reduction in stress in the form of yoga and meditation also brings about a good change. Avoid plastics and avoid toxic substances, probably in the form of shampoos or other body products. So all these put together forms lifestyle modifications, and even a weight loss of about 5% of the existing weight can bring about a good change in the symptoms associated with PCO. And like I told you already, that PCO, we basically cater to the needs of the patient. Uh, Whatever symptoms are bothering the patients, we give attention to that and treat those symptoms. So now, if the symptoms are irregular periods, that's when, of course, along with lifestyle, we also have a set of medicines that we can give. The first one is oral contraceptive pills. So these pills have a combination of estrogen and progesterone, and they're taken daily for a period of say 21 days. And when taken for about 6 months, there is improved insulin sensitivity. The androgen levels come down, and therefore the cycles get regularized. Also, apart from oral contraceptive pills, we can also give the patient some progesterones. Usually, they are given towards the second half of the cycle for a period of say 7 to 14 days. And once the medicine is stopped, the patient usually gets a withdrawal. So when the cycles are irregular for a prolonged period of time, the question arises as to when are we supposed to give these hormone supplements. So at least 2 to 3 months after missing a period, these progesterones are usually given. 3 months is usually the limit where we can expect a woman to get a period, because prolonged estrogen exposure also is not healthy for the endometrium and can have long term side effects in the form of cancers and other conditions. Uh, Along with OC pills and progesterones, the other way of treating irregular cycles is putting in an IUCD, that is intrauterine device. This also helps in contraception along with regularizing the periods. It also has a protective effect on the endometrium, like I was talking about, because this unexposed estrogen can lead to endometrial cancer. So the IUCD can help prevent those conditions, those long-term effects of PCO as well. The next symptom probably is that of infertility that women can complain of. So there is an array of treatment when it comes to infertility. Number one, we can give them some medicines for ovulation to take place. The problem with PCO women is that they have a number of eggs, but not that one egg grows which ovulates and which brings about pregnancy. So that is the issue, the growth of the follicle or the egg. So we give them medicines for the follicle to grow in the form of clomiphene citrate or letrozole. These two medicines are given, and then once the egg grows, we can proceed to do a natural cycle, that is time intercourse, or IUI based on the other fertility factors. Injections also can be added on. Sometimes women don't respond to just oral medicines, so we add on injections for the follicle to grow. Usually, we start with about 37.5 international units and step it up after about 7 days, and this is based on the patient profile as well. Apart from drugs that bring about ovulation and during a time intercourse or an IUI cycle. The last resort in fertility is IVF, that is in vitro fertilization, wherein we give injections for all the follicles to grow. We extract these follicles and mix it with the sperm, create embryos, and this embryo is thereafter put into the uterus of the female. Now, very important to understand is the role of metformin in all these. Metformin decreases the insulin resistance, improves the insulin sensitivity, decreases the androgen levels, and thereby brings about ovulation even naturally. Metformin not only helps in this, but also it improves the effect of the drugs that were giving the injections. It also decreases the side effects of these injections, which could be in the form of OHSS, that is ovarian hyperstimulation syndrome. So women who are also not willing to take hormone supplements, that is OCPs or progesterones, for a prolonged period of time, can stick to taking metformin in dosage of 1,500 milligram per day for a prolonged period of time, say about a year or 2 years, and this can bring about cycle regularization and ovulation. Nausea, vomiting, abdominal discomfort, are some of the side effects that we can expect with metformin, along with probably lactic acidosis, which is a rare complication, but these are some of the usually women tolerate metformin quite well. And the next symptom is that of hirsutism, that is excess hair growth. This problem can be addressed by giving drugs like spironolactone, anti-androgens like flutamide, finasteride, and these drugs are can cause congenital anomalies. So it is better we add on an effective contraception alongside when these anti-androgens are used. Local cream, that is eflornithine, can be applied. This has ornithine decarboxylase as an enzyme that helps in removal of the excessive hair growth. Once we stop the cream, the hair growth can recur. So it is better to consult a dermatologist or a fertility specialist for this kind of an issue. Apart from these treatments, laser hair removal is another way to deal with hirsutism. And these are most of these symptoms of PCO are already addressed to you. The other symptom is acne, and we have retinoic acid and local topical ointments that can help with acne, which is quite a distressing symptom. And apart from lifestyle changes and ointments and retinoic acid, a dermatologist can further help with acne. These are the various modalities that help us in the treatment of PCO. There is one more that I wanted to talk about, that is laparoscopic ovarian drilling, the role of laparoscopic ovarian drilling. So, what laparoscopic ovarian drilling is that about four holes are made, which are about 4 mm deep in each of the ovaries. Now, this helps in decreasing the LH levels, decreasing the androgen levels, and thereby brings about ovulation. But on the downside, the number of follicles that are there gets reduced when we do a laparoscopic ovarian drilling. So most often this is done in patients where we are otherwise also doing a laparoscopy and the patient stays far away, doesn't really come back for treatment or doesn't is not compliant. So in these kind of women, we can try laparoscopic ovarian drilling. But otherwise, it is better to avoid laparoscopic ovarian drilling and try these other methods of treatment for PCO. The reason being, when we do laparoscopic ovarian drilling, the number of the AMH, that is the number of antral follicles that are there, they get reduced. So when we do treatments for fertility, sometimes a woman with a lot of follicles finally ends up with very few follicles. So that becomes a challenge later. So this is all about the various treatment modalities that exist in polycystic ovarian syndrome. Any questions, please? So future health problems and side effects, like I mentioned, it can cause diabetes, it can cause endometrial cancers, it can cause high blood pressures. So when we use metformin, it is protective. Of course, lifestyle changes plays a very important role. And if you don't get a period for say for about 3 months, that's when we are looking at getting a withdrawal to prevent the unexposed estrogen exposure, which may lead to cancers. These are some of the long-term side effects of PCO, which can be prevented. So the major health issues, like I just mentioned, you have short-term side effects, long-term side effects, and I have already spoken to you about what can happen with short-term side effects, that is irregular cycles, acne, hirsutism, fertility issues. These are some of the problems related to PCO in short term. All these problems can also lead to depression. The long term side effects include diabetes, endometrial cancers, high blood pressures. These are obesity, of course, These are some of the long-term side effects that may exist with PCO, and these long-term effects can definitely be prevented and handled better with good lifestyle and proper medicines, supplements. So there is no cure for PCOS. We can only symptomatically treat the patient. There is no immediate effect. Whatever is the concern, whatever is the problem of the patient, we try to treat that issue. PCO, it is very easy to figure out whether you have PCO or not. Importantly, you will have irregular cycles, anovulation, scanty periods, or features of hyperandrogenism, that is excessive hair growth on the face or elsewhere on the body, alopecia, that is thinning of the scalp hair, and these are some of the features of hyperandrogenism, along with an ultrasound finding of PCO morphology. Also, we test the androgen levels in the blood, even if those are high. These are some of the constituents of polycystic ovarian syndrome. If you have two out of these three, then you fall into polycystic ovarian syndrome category. What happens if PCOD is untreated? So, if PCOD, it depends on your symptoms. Some women who may have PCO on ultrasound, they may have bulky ovaries, but their cycles are regular, their androgen levels are normal, they don't need any treatment. But if your problem is irregular cycles or obesity or insulin resistance, if you're having acne, hirsutism, then you require treatment. And if you don't, if your cycles are irregular, like I said, if you don't get a period for more than 3 months and you don't get yourself treated, you are at a risk for these long-term side effects that I have already explained. Uh, it depends on people and their symptoms. So for people who are obese, the treatment is slightly different. For people who have PCO yet are having a normal weight, normal BMI, so the treatment is different. The effect can be brought about in both the category of patients. The way we give the medicines and the kind of treatment that we offer is different. Thank you.